All right. So thank you so much, Krysti, for agreeing to come onto the podcast again. Because the first time we had terrible audio issues. So I really wanted you all to hear this story, which is why I asked her to come back. So thank you so much for coming back again to record your story.
Sure, happy to be here.
Yeah. So why don't you tell us a bit about yourself and your family?
I live in Connecticut, in southeastern Connecticut, pretty close to the shore. And I live with my husband, our two dogs, and our son, Leo, who is now 16 months old.
Okay. Yeah,
Yeah.
I think the first time I recorded, we did not have a dog. Now we have a dog, and now I'm like, having a dog is a whole nother has a whole nother
Oh,
flavor into the
yes.
mix. And you have two dogs.
Yes, we do. Yeah.
Yeah, yeah. And I bet it must be nice living close to the shore.
Yeah. It's a
Yeah,
lot of fun. We
yeah,
um we are a pretty active outdoorsy family, so it's great to be able to have that as an option.
yeah. So, of course, in order to understand the birth, we have to talk a bit about the pregnancy. And in your case, your pregnancy was conceived through IVF because you have mosaic Turner syndrome. So, can you tell us a bit about what that means?
Sure. So, Turner syndrome is a condition where there is um, an abnormality in the sex chromosomes.
Mm-hmm.
So, in an individual who is genetically XX, they would be genetically female, and then XY, genetically male. And so, in Turner syndrome, uh, an individual can have either a complete Turner syndrome where it's all cells are X, essentially X nothing. There's one
Mm-hmm.
X only.
Mm-hmm.
And
Mm-hmm.
then there's also a condition called mosaic Turner syndrome where it's not full blown Turner syndrome. And that's what I have. So roughly 15% of my cells are missing an X chromosome. And one of the conditions that goes along with that is infertility. Not always, but in my case, unfortunately, I am not able to conceive naturally. I don't cycle. So IVF was really the best and potentially the only option for our family.
Gotcha. So that's how you found out you were trying to get pregnant and then had difficulties getting pregnant.
Yeah, and actually I was on birth control for a very long time
Mm,
and was getting a period with birth control. And
mm-hmm.
then when I went off birth control, it was a little over, I want to say it was almost a year that I just wasn't cycling and we were trying to get pregnant. And so then we had to figure out what was going on. So,
Gotcha.
yeah.
And how long did it take to figure out? Because it's not a common thing. So sometimes, did you feel like you got a little bit of a runaround before you, or did it take a
Yeah.
while?
Yeah.
Mm-hmm.
So I'm a runner, and the initial thinking was that it was something linked to my hypothalamic pituitary axis and kind
Mm-hmm.
of low body fat. And
Mm-hmm.
so
Mm-hmm.
I went to, was it four or five doctors? And dug into some family history and
Mm-hmm.
realized that I needed some additional testing.
Gotcha. Gotcha. Well, I'm sorry it took so long to figure it out, but I'm glad eventually you did figure it out.
Yeah, we
Yeah.
were really, I mean, as shocking and kind of, it was tough to kind of swallow
Mm-hmm.
the diagnosis, but to be honest, it was almost a relief because it was a long time of, just frustration, not understanding what was happening. So
Yeah. And then you knew you could, like, there was something that could be done to address
exactly.
it. Mm-hmm.
Right.
Yeah. Yeah. And how was IVF for you? Was that a stressful process?
It was, the hardest part for me was was waiting in between stages. And we started the process in February of 2020. So our fertility clinic shut down for several months, starting in March of 2020. So we got the diagnosis and we were really excited to get started. And then we had to wait several months. And so we were able to start the process in July of 2020.
Okay.
So it wasn't horrible, and once that got started, we were very fortunate in that we had success at every step of the process. Yeah. And so we were able to get 2 healthy, genetically normal embryos in our first cycle. And one of those embryos is our son, Leo.
Okay. All right. That's awesome.
That
is awesome. I know that's it's a very stressful process. Like pregnancy is such a like timing thing, and it's like there's some points in it where you have no choice but to wait. Like there's nothing to do but wait, and it can be like nerve-wracking for sure.
Yes.
Sure. Yeah. Okay, so once you found out you were pregnant and things went well, what was your pregnancy and your prenatal care like?
My pregnancy was very, I'm trying to think of a word to describe it.
Okay.
I didn't have much discomfort or illness. It was pretty smooth sailing. At week 20, I think it was, I had my anatomy scan, and there was concern that I had a condition, I think it's vasoprevia, where there are blood vessels running over the birth canal. So that was a little bit of panic there for a couple of weeks. But then I got a repeat ultrasound, and everything looked okay. There was a marginal cord insertion though, so I had to be monitored closely, just to ensure that that the baby was growing okay. As one of the concerns with that is low birth weight.
Yeah.
So I had ultrasounds every 2 weeks from, I want to say, about 26 weeks on, to monitor growth scans. And my prenatal care was excellent. I went to a practice that has both obstetricians and midwives, and I rotated between the midwives and OBs depending on, who was in office that day. Gotcha. Which was great.
Okay, so you ended up seeing then a lot of different folks for your prenatal care and meeting all of the potential different people who you can meet that could be there for the birth.
Right. And I did go to maternal fetal medicine for the growth scans to monitor weight and length.
Gotcha. So overall, pretty low key pregnancy, other than the things you mentioned, and you felt satisfied with your prenatal care.
Yes, very much so.
Well, good. So what did you do to prepare for your birth?
I really tried to stay active. So movement has always been kind of my go-to when I'm not feeling so great or when I'm feeling off. And so that was kind of my touchstone throughout my pregnancy. So I continued running, walking, hiking, and I feel that really kept me in a good mental space. And in terms of preparing for the actual birth, I read a lot. I listened to podcasts, listened to the birth stories, talked to a lot of my friends who have children. And one thing I really tried to not do is plan too much. And it was very against my nature. I am type A personality and really initially wanted a step-by-step, this is exactly what's going to happen. This is the pain
Mm-hmm.
medication I want. And then I just kind of surrendered and just accepted that whatever is going to happen is somewhat or mostly out of my control, and that I'll just have
Right.
to roll with it.
Right. Right. What do you think helped you get to that point where you felt like you could surrender to the process?
I think just hearing other stories and just
Mm-hmm.
trying to tap into my rational mind and just understand that there's absolutely no way that I am going to know what's going to happen.
Mm-hmm.
And that I think a lot of it is too, is that I was just so grateful and felt so fortunate after what we had been through, that I
Right.
was kind of like, well, I just need to take it in stride and just be so happy that I'm able to experience this.
Right. 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 Look at so gratitude really and
Yeah.
looking for the good pieces and things.
Yeah.
Yeah. Was there anything in particular that you wanted for your birth?
I wanted to be relaxed, and I wanted it to be a memorable experience in a good way. However, I know that in a lot of cases that's not possible,
Mm-hmm.
but I didn't want to unnecessarily put restrictions on it in a way that would make it more stressful or more painful, or um just, I guess in some, I wanted it to be a good experience.
Gotcha. 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 So then what was your labor and birth like? Let's talk about that.
Sure. So I had a growth scan scheduled at 38 weeks and 5 days, I think it was.
Uh-huh.
And that the night before, I was feeling off and thought I might be feeling contractions, and I
Okay.
kind of just chalked it up to Braxton Hicks, and you know first babies never come early, and
Right.
so I, in typical fashion, the next morning I woke up early, tried to move through it. I went for a run. I ended up meeting up with my sister-in-law and my nephew to go
Uh-huh.
get donuts and
Uh-huh.
walk around.
Right.
I was
Right.
off work at this time. I had maternity leave that started before my delivery date, so
Okay.
around,
Oh, that's nice.
yeah, I had 3 weeks
Yeah.
off before my anticipated delivery date, which was
That's very
awesome.
nice.
Yeah,
Yeah.
yeah. So around like 11 in the morning, I started to feel really off, and I was like, okay, something is going on. I don't know what it
Okay.
is. So I
Right.
called my doctor, and they said, well, start timing it and let us know. And my appointment was at 1:30, I think.
Mm-hmm.
So
Mm-hmm.
closer to the appointment, I called again, and I said, you know, I'm starting to get them like relatively regularly, between like 5 minutes apart, 6 minutes apart. And they said, okay, like somewhat reluctantly, we'll call in a midwife. and
Okay.
and
Right.
so I called my husband. He was at work, and I said, we gotta
Mm-hmm.
go. I mean, so we get in the car and we start driving. I'm about 45 minutes from the hospital that I chose to deliver
Okay.
at. And that was a car ride. Let me
Yeah.
tell you. I mean,
I think we don't talk about that enough. The
yeah,
car ride to the
no.
hospital can be really intense.
Yeah,
Yeah.
things escalated very, very quickly. So, um, we made it to the hospital. It's all kind of a blur from there,
Mm-hmm.
but there was a line to check in, and I just looked at my husband. I said, I can't stand in that line, and
Like that's not gonna happen. Like do what you
yeah.
got to do, but we're not doing the line.
Yeah, so they put me in a wheelchair. It was very dramatic, wheeled me across the lobby, got me into a
Right.
triage room, and then things kind of slowed down a bit. And I don't want
Okay.
to say that I was being um dismissed, but I think, I was coming in as a first time mom, 9 days
Uh-huh.
early. And so
Uh-huh.
one midwife checked my dilation and kind of whispered to the other midwife and looked a little surprised. And then the other midwife checked and I was 8 centimeters dilated.
Wow. Wow. Okay. So things had started kind of that night and then ramped up during the day.
Yeah.
And you were still kind of like, yeah, things are getting closer together. And then it sounds like on the car ride, things
Yes.
really ramped
Yeah.
up. But it was only a few hours that things
It
were
was,
pretty, and
yeah.
not that
Yeah.
long.
No, it was not
Yeah.
long. I was,
Yeah.
yeah, I was at home, kind of moving around, bouncing on the ball at like 12:30, I want to say. And then we were in the
Right.
car at like 1:30 and things
Right.
just,
Just
yeah.
went from there.
Yeah.
Okay. So what went through your mind when you heard you were 8 centimeters?
This makes sense.
Okay.
Because the way I felt, and I just thought, I can't take much more of this. I mean, it doesn't really
Uh-huh.
get worse, or not worse, but does it get more
Right.
intense than this?
Right.
Because this
Right.
is a lot right
This
now.
is right. 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 Right.
Yeah.
Right. So then what did you decide then? Like what were your thoughts around what did you wanted to do for what you wanted to do for pain management?
I said, give me whatever you can. So, I mean, I was not against any type of pain relief that I was knowledgeable about. So I knew, I was not against having an epidural, whatever was needed for a calm birth. So they ended up giving me a spinal and epidural.
Oh,
Yeah,
okay.
so the spinal provided immediate relief.
Uh-huh.
And then the epidural after the fact was, it took about like a half hour, I want to say, to kick in. But from then on, it was so calm, and
Uh-huh.
things still moved relatively quickly. But it was just uh, it was the experience that I wanted, for sure.
Gotcha.
For sure.
Gotcha. So you from the triage room to when they got you to the room, did things move pretty quickly? Were they like, "Oh my gosh, she's 8 centimeters. We have to."
Yeah, so I actually never made it to a delivery room. I was moved to another triage room. The hospital was like overflowing. So, and
Okay.
things just moved so quickly that they didn't have a
Right.
room available. So,
Gotcha. Okay, so
yeah.
you had to stay in the triage
Yeah,
room.
so luckily at one point they were able to bring in a bed, like a delivery bed.
Right. Right.
But yeah, I ended up giving birth in the triage room.
Oh, those rooms are tiny
Yeah,
too.
yeah.
They're like little, I mean, for the most part, in most hospitals, they tend to be pretty little. They're not like the expansive
Yeah.
sort of rooms. Were you disappointed? I
Not
mean, I guess you couldn't do anything
really.
about it.
No,
So,
no.
okay.
The only thing that I was
Okay.
a little bit disappointed about was they didn't have they didn't have the equipment really that they needed in that room, so
Mhm.
they didn't have
Mhm.
a scale. So we had to wait a little bit after he was born for my husband to hold him. So I got to, of course, hold him immediately, but they ended
Right.
up having to kind of take him here and like try to find a scale. And so there was just a little bit of commotion after because they didn't
Gotcha.
have all the
Gotcha.
typical equipment in that room.
Think. Okay. 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 So what happened from when you got the epidural to pushing and Leo being born? Tell us about that.
So as I said, things really started to slow down. I got moved into that
Mhm.
other triage room, and I was hooked up to a couple of monitors just to monitor his heart rate, and then also one to monitor contractions. So after I got the
Mhm.
spinal and the epidural, I wasn't really able to feel the contractions. I felt pressure. Um,
Okay.
so the nurse was helping me kind of she was kind of guiding when the contractions were coming based on the monitor.
Okay.
So I reached 10 centimeters. I want to say it was in about an hour.
Okay.
And then started pushing, and I pushed.
Oh, did your water break
Oh,
at some
yes,
point, or did
yes.
they
My
break your
water
water?
broke in that first triage room. It was probably like my water broke. And also I was group B strep positive. So they had to figure out
Gotcha.
all the, I had to get the IV
Mm-hmm.
and,
Mm-hmm. And I forgot to ask, did when they saw you were 8 centimeters, did anybody talk about at all, like, do you want to keep going
yes.
without an epidural?
Yes.
Okay.
There was one midwife. She was
Mm-hmm.
so lovely. And she kind of just looked me in the eye and she said, you're in it. I mean,
Right.
we're not going to try to, I can't remember exactly what she said, but basically it was like,
Sure.
we're not
Sure.
trying to lead you one way or the other, but you're in transition.
Right.
You could, continue.
Right.
In those words, more or less. And I said,
Sure.
no.
Sure.
I said, nope. And
No,
then it was
thank
just
you.
okay. I mean, I didn't even sign. The anesthesiologist was also wonderful, and she just said, I'm going to verbally consent you. We'll have you sign everything after. So
Okay.
I did a verbal consent for everything. They were just as fast as they could have
Gotcha.
been. So.
And had you already decided beforehand that you knew you wanted to get an epidural, or were you just going to play it by
Yeah.
when you were going through it?
I initially I wanted to try nitrous oxide because nitrous oxide, and I think if I had gotten to the hospital earlier, I might have gone that route because it felt really good for me when I was home, kind of just walking and bouncing on the ball and getting into different positions. But I think by the time I got to the hospital, I was so far along that I just didn't want to go that route anymore.
Gotcha. Okay. So you got to completely dilated, and then how did things go from there?
So I pushed for, I think, around 45, 50 minutes, so a little under an hour. Yeah.
Okay. Could you feel anything? Because it sounds like you had a dense epidural.
Yeah. So once I started pushing, I actually started to have back pain, really bad back labor. So Leo, he was sunny side up, so he had to turn as he was coming out, and wanted to try to do that naturally. They didn't want to have to try and turn him. So that part was pretty painful. But I was able to, I pushed on my side a lot. Kind of rotating between my side, like one side and the other, which was really helpful in relieving some of that. And one of the nurses was actually pushing on my back as well, which was helpful.
Okay. So you felt like you had great support and encouragement while you were pushing.
Yeah.
Okay, that's impressive. Even in the triage room, I'm just thinking about our own triage rooms. They're so they're like tight spaces. So for them to be able to do all of those things and help and support you. Yeah. So then you said you pushed for about 45 minutes, and you were with the midwives. Is that right?
Yes. So there was one midwife and two nurses came in. Kind of at the last moment as I was, as he was kind of coming out.
Right. Why didn't the midwife just stay?
So the midwife stayed, but the OB, so everyone stayed, and then the OB came in at the last moment.
So then what was it like pushing him out of your body?
It was, I can't really remember that exact moment, but I remember directly after. I mean, he cried immediately. Everything was perfect. It was best case scenario. He was really healthy. Right. He was small. Right. And I think he weighed a little under 6 pounds.
Okay. Oh yeah,
Yeah,
that's
so
tiny.
not
Mm-hmm.
really really tiny. I mean,
Mm-hmm.
he didn't have to go into the NICU or anything, but I mean, it was just a surreal moment. It was
Mm-hmm.
just incredible.
Yeah. 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 And then did they do also? Okay. Okay. So brought them straight on your chest, delayed cord clamping, and it sounds like it was just everything that you could have
Yes.
wanted.
Yeah,
Okay.
it was.
That's wonderful. That is wonderful. That is wonderful. So then what was the postpartum period like for you?
Um, it was tough for me. I think,
Okay.
being a runner, I just have always had the mentality of kind of trying to get back to things really quickly, injuries.
Mm-hmm.
So it was hard for me in that I had to really um, physically slow down. And it was
Mm-hmm.
humbling in that sense.
Oh, I forgot to. I'm sorry. Did you have any tears? Did you have to get any
Yes,
stitches
yes,
or
I did.
anything?
I had
Okay.
a very minor tear, so I just,
Okay.
yeah, I
Okay.
needed stitches, but it was, I think it was a first degree.
Yeah, that's the
Yeah,
most minor.
yeah,
So,
it
yeah.
wasn't
Okay.
bad.
Okay. All right. Gotcha. So, you were thinking, I mean, were you expecting that you were going to be able to get back to things quicker than you actually did, or how you
I
were
think
feeling?
so.
Mm-hmm.
And even after, my 6 week follow-up appointment, when you're, cleared to
Mm-hmm.
do everything, I tried to kind of jump back into it. And I was so not even close to being ready. In that sense, it was difficult, for me, but I guess on the other side of things, it was also just, in incredible, like really special time for our family.
Right.
So my husband was
Yeah.
weeks off, and so just having the three of us plus the dogs at home, and just kind of being able to bring Leo home, and it just felt so right. I mentioned we have
Mhm.
my husband and I are from the same hometown, and both of our families are local, so we have an incredible
Oh,
support system. Yeah,
that's nice.
yeah.
That's nice. So I'm sure you had lots of meals
Yes.
and things
Yeah,
and
yeah.
help. Yeah.
We had
Yeah. Yeah.
lots of visitors, which was just, it was just so special to, have Leo meet everyone. And I had leave as well. I had 5.5 months off. So
Oh, that is nice.
yeah,
That is
yeah,
very nice.
yeah.
Very nice. And let me ask, for you said you went to physical therapy. Is that something that you took upon yourself to do, or did your doctor
So my
recommend it?
doctor ended up recommending that I go to physical therapy due to
Okay.
due to the back pain. Yeah, not have kind of put that together, but yeah, it ended up
Mm-hmm.
helping a lot.
Okay, good. And did
I
you breastfeed?
did. Yes.
And what
So
was that like?
I actually, this is very contradictory to what I expected. I actually
Mm-hmm.
overproduced.
Huh.
So that was pretty surprisingly challenging to try and
Uh-huh.
and kind of get the hang of that, but I ended up.
So did you just have lots of extra
Yes.
milk?
Yeah, I actually ended up donating quite a bit, which was great that I was able to do that.
Right.
And so I breastfed for about 11 months, and then
Okay.
had a freezer stash, and then I donated some. So yeah, yeah.
Nice. Yeah, people, breastfeeding is always like, you never know until you get into it. And some people are like, oh, how could it be bad to overproduce? But it's like
Yes.
there's like constantly milk.
And I had to start pumping pretty much right when I got home from the hospital, and I didn't know. I had no idea what was going on. So he latched
Hmm.
beautifully in the hospital. And then when I got home, lactation consultant, and she said, you might
Uh-huh.
just have to start pumping a little bit. because you're just
Okay.
too full. He can't latch. And yeah,
Gotcha.
so
Okay. Yeah, I've always called breastfeeding a labor of
yes, for
love. It's
sure.
not necessarily
For
the easiest
sure.
thing in the world. And then, like, your whole world revolves for a while. So, oh, all right. So, how are you feel? How do you feel overall about your pregnancy, your birth, your postpartum experience?
I'm really happy with how everything turned out for me.
Mm.
I think it was really, and I keep saying best case scenario, but it really was.
Mm-hmm.
And I think I'm probably forgetting a lot of the hard part. Yeah, I mean, my care, prenatal and postnatal, was wonderful. Our IVF clinic, our fertility clinic was wonderful. So really happy about all of that.
Yeah, that's amazing. And do you ever feel like sometimes I see that when people have challenges getting pregnant and then they're so excited and they have a baby and then sometimes if the baby's like colicky or there are issues and they feel like, well, this is the expectations don't match up to what they were thinking. You know, they're thinking it's going to be this beautiful experience. Did you ever have any of that where you were like, this is harder than I wanted this baby, but it's harder than I thought it was going to
Yeah,
be.
it was definitely, I knew it was going to be hard, but I think it was a different kind of hard than I expected, and I don't really
Mm-hmm.
know how to describe that. And I think to myself sometimes when things are really tough, if I'm a little bit more accepting of it because we had such a hard time, but then I think, well, am I just
Mm-hmm.
more accepting of it because I just love him so much? I don't know. It's just hard to
Right.
say.
Yeah. I totally get that. I totally get that. And then the last thing, as we wrap up, what is your one favorite piece of advice that you would give to someone who's getting ready to have their baby?
I think my number one piece of advice would be, and I know you preach this as well, is to just advocate for yourself. Um, Luckily, I had a
Mm-hmm.
really great experience, but there were a couple of times where I had to speak up and really kind of, um, reinforce what I wanted, and if something didn't sit right, I addressed it. So I think it's easy to kind
Mm-hmm.
of just go with the flow a lot of the times, and you want the experience that is right for you. So yeah, definitely just advocate for yourself.
100%. 100%. All right. So, where can women connect with you? You can say nowhere if you're not on social media or
Yeah,
anything.
so I think probably Instagram would be best. So my Instagram is Krysti 430. So Krysti 430.
Okay. Uh, Perfect. Perfect. We will put that in the show notes. Well, thank you so much, Krysti, for agreeing to come back on and record this
Sure.
again. And it was just as delightful the second time. So I appreciate
Yeah,
it.
thank you so much for having me.